have patients who come here who are very scared. And I think that the initial approach is just to find out about the patient. Where you're from, often we'll know somebody from that area, we'll talk about that, let them understand that we really value what their background is. That helps put people at ease and letting them know that there may be a number of steps that we go through and we're going to be there with them each step along the way.
So with the patients that we take care of, it's not just them, but their entire families that we really have to help support. I take a lot of pride, and I know, again, I'm sure you do too, how we really do try to support them as best as possible. There's a lot of shared decision making that takes place because they have to live with the therapies that we have provided. So a very recent experience that I had, we had taken care of someone very sick, as is, when I say that to my husband, he says, "What's new?"
Right. Yeah.
Someone very sick, ended up on ECMO, very prolonged ICU stay, got a durable LVAD, and made recovery. She was a mother. She had 3 kids, if I remember correctly. It was the day before Mother's Day, and I was rounding, and she was talking about how her kids are going to visit her the next day, which wasn't going to be the case when she first showed up at her doorstep. So, as a mom, that was really touching.
We have to be organized in a way that we're doing the best that we can and that we're listening to patients and their family and we're providing the care. And then if we have a bad outcome, I realize that my role doesn't stop when that happens, that I've got to be there to support the family and follow up.
We do develop these lifelong relationships with these patients. They see us, they see me before I had kids, when I was pregnant, now after I've had kids, always asking us about our kids. We get to see them go through their life events. Yep. It's quite remarkable. And these are people that wouldn't have had any of these life events. So it's quite amazing what we can do. Definitely letting them know that we're going to do this together. They're not alone in this journey, and that we will be there with them every step of the way. And we're gonna talk about it and figure out what's the best way for them to be successful, and asking them what that means. Right. Helping them along that journey.
Absolutely. I think the other part of that is it's not the patient's here and we're here and we're telling them what they have to do. The way we like to approach it is the problem's here and we're here together with them, and we're going to look at what the barriers are to improving their health, and we're going to try to work through those barriers with them.